great. We'll start with just, we have time for probably maybe one question. If someone has a question or comment on or from the materials that were on the website for this module. If you have one, you can just raise your hand or we can go straight into our small group discussion. And Gokul, will you help me see if there's hand raised because my view is I can't see everyone.
Yep, sure.
Okay. Okay, so then we're going to jump right into it. So the first prompt for the small group discussion is think of a problem as part of a member organization project or otherwise, and apply one of the root cause analysis tools to help you identify help you identify the related issues. And so there should have been a slide that everyone received with a fishbone that you can use to work on this prompt. Did everyone receive that? It was in an email. Great. Okay, so we're going to go into our breakout rooms. There's going to be, what, four of them, Gokul? Four
Yes,
breakout rooms. We have about 30 minutes. Is there a timer on the breakout rooms, Gokul?
yes, I can do that. Yeah.
Okay, so we will have a timer and then we'll come back and have discussion. So Jane, I see your hand is raised.
Sorry, just want to check, Heidi, do you want one example from each group? Like somebody just pick an example and then you want to share screen and show the fishbone when they come back, or how do you want it?
Yeah, because we have 15 minutes when we come back. So that means that each group will have about 4 minutes, 4 or 5 minutes to discuss it. So if
Okay.
in your group you can fill it out and then share the screen, I think Gokul can give you the permissions to do that. Otherwise, you can just give us all a kind of a verbal update of the
Okay.
discussion, but using that as the framework for your discussion.
Okay.
Great. Okay, so we will move into the breakout rooms. Gokul, can you walk everyone through this process?
Yes, so I'll open the room so you can choose between the English rooms and the Spanish rooms if anyone is in the same room. If the facilitators are in the same room, I'll sort of change them. And yeah, I'll do the bit.
Yeah, you might get moved around if everyone selects one room and we need to kind of redistribute people.
Yep, so I'll open the
Okay,
room.
so then we'll meet back in 30 minutes for a discussion. So be prepared to have someone from your group report back. Okay, so you should all get the prompt to join a room.
Heidi, is there any specific room that you want Pablo and I? Which room should we go into?
Gokul, have you assigned them to a room?
So yeah, I think you can join room two. Beth, you can join room two, and Pablo, you can
Okay.
join room three.
This is because Heidi, sorry, because I have to leave a little bit earlier.
That's
I
correct.
think I wrote to Bridget, so if I can have some help as
Yeah,
to
so can
facilitate.
Pablo and Carmen be in the same room? And
Thank you, Heidi.
yeah, thank you. We got your email, Carmen. Thanks. So then I'll join room 3,
Sure. Yep.
unless Jane's in there. And I see there's a couple people who haven't joined a room. So you guys should have a prompt on the bottom right of your screen that says join breakout room.
No, I don't have. Oh, yes, now.
So like room 3 needs more people. Monique, you're saying you don't see it?
I don't have the option.
And Caroline, so Gokul, can you just assign
Now
them
I
the
see it.
rooms?
Thank you.
I'll assign them. Yep.
I was doubled up in a room there, so Goku, you might change me to.
So can
Sure.
you go into room 3, I guess?
Okay.
Yep. And it looks like,
Yeah, I think we're good now.
And it looks like there's Ahmed needs to join up or needs to be assigned to a breakout room.
So sorry, I'm late.
Oh, that's okay. We just are people are joining breakout rooms, so Gokul will assign you a breakout room.
Yeah. So whoever's left, you can just join the group. Okay. So I think everyone's almost there.
Ahmed, okay.
Yep.
All right. So we have everyone. Does Birgit normally join a room?
Yes, she does. Yeah,
Okay.
yeah.
And then the timer is set, so we'll all be prompted to come back in
It'll
here.
be prompted. Yeah. You can.
Okay.
You can see it at the top. I'll.
Yeah.
Hope you had some nice conversations. So we have 20 minutes to and we had what, 4 breakout rooms, so we have about 5 minutes. If people want to have someone from their group share. I was in group 1, I believe, so we'll just go in order. So group 1, Ashok was going to presented a nice fishbone, and we'll share that with you. And Ashok, I'll keep, if you could keep track of the time, but I can also give you a reminder if you want.
Thank you, Heidi. My timer is on. I kept it.
Oh,
Thank
great.
you. This is just a simple example of root cause analysis using the fishbone diagram. I just presented a practical problem that we encounter in clinical education of our students. The main problem is why do we have poor clinical outcomes or outcomes in preceptor-based clinical education of our students. Our department has more than 700 students, so each year we'll have more than 200 students. So we cannot accommodate all the students in one hospital. So we spread the students and send them to different hospitals across the country. And based on the rotations, it's going to be musculoskeletal, pediatrics, obstetrics and gynecology and so on. They'll go to different specialized hospitals. So what we see is they are taught by preceptors employed in the clinical sites. And so I used the 6M model to look at the root causes or problems leading to poor outcomes in clinical education. So the first M, methods, there is no standardized teaching framework. There are unclear learning outcomes, and the preceptors are more oriented towards treating patients rather than teaching our students. Next term is machines. They do not have a shared learning management system. For example, in the university we have something called as Blackboard, and also we use another learning management system to compile all the clinical portfolio of all the students, but the preceptors outside will not have access to it. There are no e-logbooks. They need to have paper-based log sheets. Our students will get signed from the preceptors, and they'll have minimal notes on that. And they also submit the SOAP notes on the documentation system. They have poor IT support in the outside clinics. They don't have the extensive one that we have at the university. Regarding manpower issues, the preceptors lack a standardized training. We try to conduct some workshops in the beginning of every semester or in the beginning of the academic year, but not everyone attends that. They have very high clinical load. They treat a lot of patients, so they don't have much time for teaching our students at times, and limited support from the university. For example, we pay the external sites for them to teach, but they are more clinicians, and we have 10 clinical tutors at our hospital. They cannot cover all the sites. They go and supervise with the things on order, so that's what they do. Regarding mother nature of the course, high patient load, that's the biggest problem, because the preceptors are mainly clinicians and they have to find time to teach our students in between. And variable clinical exposure, some people have undergraduate qualification, some people have specialized training, or some people have master's degree, and very few have a doctoral degree in the clinical side. So the expertise level differs, and also the knowledge levels as well as the clinical experience differs. And the teaching is not prioritized for them. They're more into clinical site, treating patients rather than teaching our students. Measurements, they do not follow standardized assessment, though we give some assessment forms and rubrics. Not everyone is filling it explicitly. The grading is more subjective rather than following an objective format that we give. And inconsistent feedback. Some preceptors give an elaborate feedback, but not all of them. Many of them keep it subjective, and because of lack of time, they keep it very short. Regarding the materials, they do not have a preceptor handbook, but they do have clinical logbook that we give and give all the rules and regulations that our students follow, but they do not have a proper manual. They have limited access to guidelines, for example, clinical practice guidelines for the country or the international ones for different conditions maybe. They do not have learning templates for the student. They do not follow a standardized one. So that is a summary of the fishbone diagram that I have. So these are the problems or the root causes that could be leading to poor outcomes in preceptor-based clinical education. And some of these things already we have addressed, and still we are trying to address most of it as much as we could. Thank you.
Great, thank you, Ashok. I think you have another minute. Do you want to maybe comment on how the tool, how it was using this tool?
Yeah, good actually, good question. Because the other one's 5 whys, I think we discussed at the end of the group that we had before. The thing is, the 5 whys, it's a bit more generic, where you can put things and find solution for the last why, going for the root cause and answering that. But this dissects the problem and gives much more deep understanding of the problems or root causes of the problem that we have. So it gives more a detailed interpretation of the problems at different levels. For example, the 6M model was much more useful, I felt. And you can also look at the causes, sub-causes of the problems. And for each problem, we can have an action, and also we can follow the responsibility matrix as we discuss in the teaching material. So it can start from different resources, where to start, and who are the personnel that are involved, time frame for that, and achievable measures at the end. So we can discuss in SMART goals. I think I crossed 5 minutes now. Thank you so much.
Okay, thank you so much.
I appreciate it.
So if you stop sharing, we have our second group. I'm not sure if that was Jane's group or Beth.
I can't remember either, but we can go
Okay.
now. Now
Great.
we're not showing a screen because I couldn't type fast enough and get it up on but Monique has a nice example from South Africa, and if she's finished in time, we have a second example from Kosovo. But
Well, I'll leave you to manage the time then, Jane, between the examples.
Yeah.
All right, so in South Africa, we're working on a project to advance pelvic health physiotherapy in the African region. So I used the fishbone, and number one was human resources. And so the shortage of pelvic health physiotherapy or trained pelvic health physios, limited undergrad exposure to pelvic health, and lack of clinical mentors, and then also limited multidisciplinary collaboration within the health system. The second fishbone was training and education. So there was no widespread undergrad or postgrad pelvic health programs. And then the high cost of specialist training and lack of an African context in the evidence and the curricula within pelvic health. The third fishbone was infrastructure and equipment, so lack of a dedicated pelvic health space, no private rooms, and limited access to consumables such as gloves and lubrication. The fifth one was funding and resources, so insufficient government funding, and in Africa, a big problem is donor dependency. And then we use community and cultural factors, such as stigma around pelvic health, lack of public awareness, cultural silence around incontinence and sexual health, and the gender power dynamics. And then last one was data and research. So a lack of local prevalence data, poor documentation systems, and then poor use of data for advocacy around pelvic health.
Great, Monique, thanks. And then we'll go to Kosovo for another example.
Yes. Hello, everyone. I didn't do the slide. I just write down the tools that I need to plan the International Physiotherapy Congress in Kosovo and figure out what problems might come up so that we can organize the Congress in the best way possible. We have looked at 6 groups of causes, and the first one is management and planning. There I have included bad time management. The goals of the Congress are not clear. Poor communication between organizing team, making decisions too late, and not having backup plans. The second, there are money problems or financial factors. There I have listed a small budget, lack of sponsorship support, high venue rental costs, and expensive equipments. and bad planning for money. The third group is human resources, which means that not having enough trained workers and having trouble communications. So staff that isn't trained and organizers who don't communicate well with each other, too much work and not enough distribution of professional roles. The fourth group is logistic and tools audiovisual problems. So there are listed not enough physiotherapy demonstrations and not enough equipment, bad seating, problems with transportation, and a slow internet connection. The fifth are participants and speakers. There I have listed not enough people signed up, speakers confirmed too late, language barriers, travel problems, and last-minute cancellations. And the last group is advertising and communication. There I have listed bad use of social media, weak advertising, and late announcements of events, bad websites or sign-up system, and not enough international advertising.
Great.
Thank you.
Thanks very much. That's our two. I would love to, if it was possible, for our two examples to put them on a Fishbone. I don't know if there's a way circulating around, because I think they're both lovely examples. Thank you. That's us done.
Great. Thank you so much, Jane and everyone. Wonderful. So the next group is Beth's group.
Yeah, hi. So our group worked on a common problem. So who would like to present from our group? We ran out of time.
Yeah, that happens. Not to put anyone at the spot, but can someone share the
know.
conversation?
Please, someone share.
If no one's raising their hand, Beth, maybe it's you.
It's okay. So we spoke about the issue of engagement or retention of physiotherapists within the association. And so we looked at different categories on the Fishbone diagram. So thinking about communication with members, thinking about the value for membership, and then also thinking about the third one. I lost the diagram. Someone from Trinidad actually had the PDF. She saved the PDF, so she maybe should be presenting this.
Oh, hi.
Hi, would you mind?
Hello.
Hello, can you present from our group?
I'm not sure how to share the PDF. 1 second. And I'm doing it from my phone.
Or you can just talk through it. That's also fine.
Right. With regards to in the different categories of persons migrating versus because of better opportunities elsewhere, or I'm trying to find the information at the same time as I'm speaking. Yeah, migrating versus correct, found it. Apologies to everyone. All right. So we are talking about different categories in terms of communication, benefit for members, and career opportunities. So our solutions for the benefit for members were insurance when you have sick or when at home with children, networking opportunities for professional networks, legal support to members, and CPD. So sometimes I can speak for my association. We have issues in terms of the association has to put up the upfront capital for some of these things. And if we don't get the correct amount of participation or engagement from the members, then it leaves the association in a deficit. And with regards to communication, we were talking about more frequent and various forms of communication, whether it is email, social media, text, advertisements, those sort of things. So the main causes we had highlighted the various causes for the possible decrease in engagement and retention of physiotherapists. And some of the core things that we highlighted was members not seeing the value of their membership. One membership country did say that something that might be affecting it is that the association is not the licensing body, so they don't have much say or much of a footing with regards to government or political power in terms of getting stuff for physiotherapists in that regard. And then PTs are not actively participating or practicing, and that's with regard to migration in some countries, or physiotherapists going in more of an administrative role rather than a clinical setting. And then we have physiotherapy, or they're going into different careers and stuff like that. And another membership country also stated that when the job market is good, they see that there's a reduced value for the association, being that they can get jobs anywhere, versus when the job market is poorly, then they would come to the association to try and assist them in finding said jobs for them.
I'm going to jump in and just say 1 minute remaining.
Yes. But that was basically what we got into. And we were just talking about motivate things we could do for motivational factors for members, where discounts and CPDs and other things to try and bring them in are concerned. That was about it.
Great. Thank you so much to group 3. So we'll move to group 4, the Spanish speaking one. So over to you, Pablo, 5 minutes for your groups.
Thank you very much. First of all, we were a very small group, only 3 people. Daniel from Argentina will be our speak person. So, Daniel, can you handle speaking English? Do you want me to translate?
Yes, yeah. Okay, I will try to speak in English. I apologize in advance. Okay. In our group, we discuss the low number of members in our associations. We talk about some of the causes and possible solutions. One of the main causes we talk is the lack of interest of the people. So insufficient perceived value from participation, for example. Maybe one of the solution is clarify and communicate the value propositions of the associations, for example. Another is the problem cause of the low membership is the cost of benefits analysis. So, for example, membership fees perceived as high related to benefits, for example, no? So one of the solutions maybe is to redesign pricing and benefit architect, for example, no? So another is the perception of lack of transparency. For example, is the trust gaps in governance and decision making. And the solution maybe, is the increase the governance transparencies. For example, publish the updates, the meeting summaries, and decision log. And another cause is the low attendance and meetings. No, for example, one of the causes of this is ineffective convocations. The solution maybe is enhanced meeting relevance and budget. The others and maybe cause of the low membership is unclear benefits for participating in this type of associations. Okay, is for example the benefits are poorly defined or communicated, and maybe the solutions is defined on the benefits, no, and communicate to the members. Yes, of improve accessibility and delivery, and create a centralized benefits portal with intuitive navigation, for example. Maybe the last one is the lack of awareness of the importance of association membership. Maybe because limited understanding of the association role or and impact, for example, so one of the causes. Maybe the solution is elevate the value propositions and narrative. For example, develop a compelling evidence-based story of the association, for example, impact or practice standards, policy, and education. I think it's the last one. Yeah.
Great.
No more.
Thank you so much, Danielle. What I think is really interesting hearing everyone's presentations, and at least from the group discussion I was in, is that you guys are all going to be well prepared for the future modules on membership and engagement and events, because you're using this, hopefully you're learning about a framework now that you can apply to these other specific areas. So that's great. We're going to have 15 minutes for the next discussion, and then we will come back and share for 10 minutes. So when you're in your discussions, think about who will present and share, bits from your conversation in about 2 minutes per group, 2 or 3 minutes. So the next discussion prompt is think of a goal you want to achieve as part of your work in the profession, and what changes do you need to make to ensure the goal is SMART? Right, so that's specific, measurable, achievable, relevant, and time-based. Okay, so we will go back into our breakout rooms, and I see Anne, you've joined us as our content expert, and you can join any of the groups if you want. Maybe if you want to join the Spanish language one, you could do that as well, because I think that one's a smaller one. So Gokul, can you set up
I'll open the rooms now.
open the rooms, and if you could just join your room again. Nice discussions in your breakout rooms. So we'll go in opposite order this time with sharing. So you have about 2 to 3 minutes. So we'll start with the Spanish speaking group. So Pablo.
Yeah, because our colleague it's driving to work, so I'm just going to be the speaker this time. So we've had a very, very interesting discussion about how to setting a SMART goal. In this case, keeping in mind that we've been discussing about growing membership, what we have agreed is, okay, our goal will be to increase our membership by 10% in the next 2 years, okay? But the thing is, it's not about only setting that goal, that we also want to be very specific or more specific in this. We want to increase our membership in the youngest cohorts of, so those people who have been practicing for less than 10 years. For that, we are going to have specific actions, which is changing and shifting the way we communicate into using less effort or having less efforts in our website and shifting that into social media with special collaborations with influencers who have a lot of impact in the younger generations, and recording short videos and doing different strategies that lead to that young cohort to get into our webpage that would be a more simplified webpage, more accessible, and they can interact more with us through the social media and that simplified website. So that would be.
Great, thank you. Oh, all the young people and their social media.
There's be some pros and cons around that. I mean,
Okay, no,
very
this is good.
fruitful, interesting conversation, but I just want to, have an overview of the topic.
Yeah, that sounds great. Thank you so much. And thank you to your group for that discussion. So now we'll move to the group 3, which was Beth's group. So you have 2 to 3 minutes to share.
Yep, so Gillian is going to share for our group.
So I just took a screenshot of what we had written up. Sorry, some of the we sort of spoke about two kind of SMART goals. One was in Sweden, it was to increase membership by 1,000 people by the end of 2026. And just, I suppose, some of the background was that the numbers had been decreasing since COVID, and they have 17,000 licensed physiotherapists in the country, but only 11,000 registered with the association. So we suppose we just kind of talked through the goal, and we felt it was quite concise goal, but very smart. Obviously, it was measurable. We had by the end of 2026. I've forgotten what the letters stand for. Sorry. Achievable. Obviously, they felt it was achievable. I suppose when we think about those members were a part of the association, so it was achievable and realistic to kind of get them back into the association. It's relevant, obviously, the more members, the more engagement, and then obviously we had a time on it, so it was by the end of 2026. Then we looked at kind of increasing research numbers and kind of publication by association members by 10% in 2026. So again, we felt this was kind of a reasonable, kind of smart goal, and it was specific, it was measurable. So we said obviously we had that 10% by the end of 2026, or in 2026, I should say. Obviously, it's very relevant. The more research physios are doing, the better our evidence is. And then obviously it was kind of just targeted as well, that it was the association members. And I think that was everything. Yes, we just kind of had a discussion around those goals. We kind of felt we'd keep them kind of concise. Didn't go too much into the how we would do it, but just the actual smart part of it.
Great. Thank you so much, Jillian. Okay, so we'll move to the second group, which Jane.
Yep. So we had a really good discussion, and Abdul from Yemen is going to feedback just a little bit of background. So it was Stig in Norway was earlier on talking about his project, and so what we tried to do was take his project and see could we apply the SMART goals to it, and kind of came from a broad overview to shrink down exactly and lock it into place using SMART goals. So Abdul, if you want to feedback what we came up with.
Thanks, Jane. Yes, our SMART objective will be to reorganize our organization in the term of human resources, to have more 10 staff members within the end of March 2026, to be more efficient, to communicate with decision makers in the country, for more advocacy for the provision.
That was it. Very, very precise. It came from a huge discussion where in Norway they were trying to relocate staff who were in more rural areas to come in to help with advocacy and centralize them into Oslo.
Great, thank you so much. Okay, so for the first group, we had rich discussion around applying the SMART principles or components to the big picture one versus kind of small ones, and how you would do that. And Yanez and Patrick are going to share their SMART goals. So we'll start with Yanez.
Yeah, thank you. Let me start. Well, my strategic goal is to establish and secure full accreditation for a new master's physiotherapy curriculum. And this will align with the national priorities and international standards. And to be specific, these are specific goals. I will develop a comprehensive curriculum framework focusing on advanced clinical skills, for example, musculoskeletal, neurological, cardiorespiratory, etc. Research, methodology, and clinical management to address specific healthcare needs in Tanzania. And measurable to submit a complete curriculum document to the Tanzania Commission for Universities and receive formal approval and accreditation as evidenced by official documentation. And achievable, the curriculum will be developed through collaboration with the key stakeholders, including local physiotherapy experts, experienced faculty from institutions like our Muhimbili University of Health and Allied Sciences and the Ministry of Health. Relevant, the program will produce highly qualified personnel to address the significant need for advanced physiotherapy specialists and the educators within Tanzanian health system, and that this will improve population's health outcomes. And time-bound to make sure that the entire curriculum development and accreditation process will complete and the program ready for students to be enrolled by June 2026. Thank you.
Thank you. As you guys can all see, this was the big things that we were talking about. So big goal in the time frame. You will all be in the leadership program, so we're going to support and watch this space with you, Patrick. So thank you. Younes, do you want to share your SMART goal?
Yes, our goal was to increase the number, or would be to increase the number of physiotherapists attending the Slovenian National Congress in 2026 in November. So from the specificity point of view, we would have to define who we want to attract, only physiotherapists or also students, international guests, and so on, and what is the plan to attract them. So the example of this would be we have to increase attendance among practicing physiotherapists and students by improving program relevance, expanding outreach, and offering early bird incentives. From the measurability point of view, we want to increase the number of attendees from 120 to 150 participants. This would be 25% comparing to last year. From the achievability point of view, we would have to check if this 25% increase ever happened before, and do we have enough promotional channels and program improvements for the next year's Congress to justify this. From the relevancy point of view, we would have to think about whether this goal supports the Congress mission. Of course, we think we do. It does, by ensuring physiotherapists have access to high-value professional development and networking opportunities, which we think is also very important. And the last one, the time-based goal or part of the SMART goal, we would have to set the milestones, the internal milestones before the Congress. In other words, we would have to set what we will do in February, in March, in April to ensure this 25% increase of attendance.
Thank you. Thank you, Younes and Patrick, and everyone who has contributed to the discussion and shared with the group. So this concludes the leadership program for today. The next module is on advocacy and change. And so Birgit will be sending out more information, but you should all have access to the website where all the materials are located, but she'll send out information about the next meeting unless she probably already has. So thank you everyone for your time and have a great rest of your day.
Thank you.
Thank you.
Bye-bye.
Thanks, everyone.
Bye.
Thank you.
Take
Bye-bye.
care. Have a good Christmas.
Yeah.
Christmas and Happy New Year to all of you.
Christmas all. Bye.
Merry
Happy Christmas to all of our colleagues.